Hello, I'm John Barrett, and I'm one of the faculty members here at the School of Nursing, and today we are going to demystify statistics. Our topic includes statistical overview, and why should we care? Well, we care because in healthcare research, we generally take a sample of the population and we do a study, and then we use statistics to help us determine whether the intervention will benefit patients of the entire population. So if you see this box on the right-hand side, you take a sample of patients, you do a study, you apply statistical measures to that study, and then you try to make an estimate on the population. Unfortunately, we can't do research studies on the entire population, so this is why we use statistics to help us estimate whether the intervention will benefit on average the entire population. That's kind of the overview or understanding of what most healthcare research is about, trying to take a sample and apply that to the entire population. Let's take a look at an example here with using some M&Ms. After looking at all these M&Ms, I'm definitely craving some chocolate today. Unfortunately, my mouth is craving more than my stomach can handle. So instead, I'm just going to have a handful of M&Ms, which is like taking a sample in a research study. This handful of M&Ms, if I eat them, is like eating a representation of the entire sample. So if I eat those M&Ms, I have a pretty good idea of what the rest of these M&Ms will taste like when I eat them the next time. Now that we understand that the majority of healthcare research is about taking samples, applying statistical analysis to those samples, and making an estimate for the entire population on average, let's take a look at a couple of the things that are limitations about that. The first is non-representative sample. What if the sample isn't representative of the population? Then you can't really make a determination of the effect on the entire population. Some examples that we see are gender, economic status, access to healthcare, race and geographic location, and age. Age is one of the big ones. If you apply an intervention to a group of healthy 20 to 25-year-olds, you're likely to have a different outcome than if you apply that to a group of people who are 75 to 80. And so that's one of the things that you have to think about when you're applying these studies. You're looking for studies that have representative samples to the population that you're trying to apply them to. As an example, in diabetes, you want to make sure that you're having a representative sample of patients who have diabetes on average so that you can apply that in the whole. Let's take a look at the M&M example, again, to look at this in a different way. What would you say if instead of taking a representative sample of M&Ms, I instead started handpicking these green M&Ms out of here? Well, what you could say is, I have a pretty good idea of what these green M&Ms taste like, but I don't have no clue what the blue, yellow, red, or brown, or orange M&Ms taste like. And that's like taking a non-representative sample of a research study. What you can do is you have a pretty good idea from the sample you have, but you don't have an idea of the entire population as a whole. So now I think you understand that one of the things you want to look for is that the population in the study is representative to the population that you want to apply the effect to or the statistical analysis. Let's look at a couple more limitations. First is sample size. The larger the sample size, the more the precise the estimate. So let's look at this study here. These are made up numbers. On the first one, you have a very large sample size, and you have a confidence interval, a statistical measure that says a 95% confident that the average estimate, if you apply this intervention, would decrease blood pressure between -6 and -10. That's pretty good. But if you had a small sample size, you might have a larger confidence interval, somewhere between -20 and +4. So just because of the sample size alone, your measure isn't precise. And if you look at this example, that measure crosses 0, so we don't know if the intervention actually helps or hurts someone with blood pressure. The next limitation is a single study. Repeating studies with similar results make us more confident in our estimate. Just take a look. If you look on the right-hand side, one well-designed study, you would much rather see 5 well-designed studies that say the same thing. You would be more confident that the result that you're going to apply or the intervention has the effect that you want it to if 5 studies all agree. The last limitation I want to talk about is bias. Bias in a study may make you question the validity of the estimate for the population. Some examples include non-random selection, which just basically means that patients weren't randomly chosen from the population, non-random assignment, which means that patients, when they're placed into either the placebo or the intervention group, they weren't randomly placed there, not being blinded. What happens if the patient knows they're taking the placebo medication or the intervention medication? Who's getting paid? What if the drug company is paying for the study? The researchers are more likely to want to publish positive results, and publication bias. Many people in academia, they get promotions based off being published, and it's harder to publish negative results. So there's some kind of push to maybe publish positive results and maybe skew the data a little bit so that they look positive. Those are things that you should look for when you're looking in healthcare research. I hope this gives you a little bit of an understanding. Let us know if you have any questions, and thanks for watching.